everyone. Welcome back to another episode of Ask a Care Manager. My name is Ryan Abramski. I'm the Director of Business Development, and I'm joined as always with Teresa Jackson, our Director of Care Management. The both of us work for EasyLiving. We're a home care and care management agency serving the Tampa Bay area for over 20 years. As always, Ask a Care Manager video series is brought to you by our friends over at the Senior Living Resource magazine and their website, seniorlivingguide.com. Your one-stop local and statewide resource for all things senior housing and health. Anything from home care services like EasyLiving to assisted living facilities, care management, senior health resources, memory care. The Senior Living Guide Resource Magazine is your one-stop shop for all things senior housing and health. So reach out to them and they will mail you an issue directly to your home. So Teresa, welcome back again to another week, another episode of Ask a Care Manager.
Thank you.
So I know we always kind of talk about different things that our care management services provide. So I kind of wanted to dig a little deeper into one of the services that you guys provide as care management, and that is accompanying your clients to doctor's appointments or specialist appointments for them when they have those appointments. And we all know sometimes it could be if it's not like a typical physical routine, but sometimes, especially with those specialists, they can be quite overwhelming and quite complicated. So why don't you run us through like what a care manager can do for their client when they accompany them to the doctor's appointment and what different things they can handle for them while they're there?
Oh my gosh, yes. This is a true benefit of our services, which can help the family, especially like if the family's out of state and they're not able to come into town, accompany a family member, a loved one to a doctor's appointment. Or, as we've spoken before, some of our clients don't have family members. Some of them have family members, and they live right in town with them, but they are busy. They are working, they're raising their family, and they just need that additional help. And it's not just someone to coordinate transportation services and meet them at the doctor and take them into the doctor's appointment, but also to provide a level of professional knowledge about what needs to be asked during that doctor's appointment. So if it's a new client appointment, a new patient appointment, I don't know if you've had one of those lately, but they instruct you to go online, fill out all this paperwork, and make sure you get to the appointment 30 minutes ahead of time so they can ask you some additional questions. Let's say you're working with a client that has dementia. It can be very difficult for them to sit and wait. And I know things have changed with COVID where most of the appointments, they're getting the patients in and out a little more quickly without that waiting in the waiting room.
Yeah.
But just to make sure that all that paperwork is filled out completely and accurately. You don't want to be sitting in a doctor's waiting room asking someone that may or may not be able to recall all the details about their medical history. So a care manager will make sure that that paperwork has been completed and typically sent over to the doctor pre-appointment. We'll also make sure it is accompanied with our consent for release of information or help authorization to make sure we follow all HIPAA guidelines regarding personal medical information, personal health information. And so once that appointment is set up, we are putting together, what is our goal? What is the patient's goal for this appointment? Is it maybe to just renew medications? Or, does the client have a particular complaint or illness or concern? We want to make sure that that gets communicated effectively to the physician.
Sure.
I mean, many, many times I've seen clients, they'll be going in because maybe there was a fall and they need to go in. The emergency room said, well, we want you to follow up with your primary care physician. Or whatever the scenario might be. And so the doctor will come in, and we always make sure that the doctor addresses the client directly. I want them to speak to the client. Now, if the client is having issues communicating, or maybe they don't remember what happened. It'll be like, well, so you fell last week. Client's going, no, I haven't fallen. I haven't fallen. And I'm standing behind the client going, yes, it was last week. It was Tuesday, you know. And sometimes you have to just redirect the client, or maybe even prompt the doctor to ask a particular question and how that might work. For example, it was a neurological assessment to screen a client's cognitive abilities. And so, of course, the doctor was asking all these questions, and the client was answering them very, very appropriately. So I had to interject and say, well, what were you going to do when you couldn't drive? Well, I went to the bank and I was going to go just buy a new car. And so that kind of gave the doctor an opportunity to see where the client was.
Yeah. So
that's how a care manager will involve themselves in an appointment. It may be, you know, you're going to a specialist, and I had this happen one time before. And the specialist was like, okay, so let me review the medications. Well, who increased this medication? The doctor said. And I looked through my notes and I was like, oh, excuse me, you did 6 months ago. So when a care manager goes into an appointment, they have to be very organized and prepared with that information. Otherwise, why are they there? So that is what a care manager will do to make sure everything is communicated effectively. And this is even, you know, there's care managers that are nurses and understand what every prescription is and how to spell it and pronounce it. You know, I'm not a nurse. I will ask the doctor, can you please spell that for me? Can you please explain, you know, what's the generic medication and why are we doing this medication as opposed to the other medication that they were on before? I want to ask these questions so I can either remind my client that this is why we're making these changes, or to communicate that to the family. This is why we are making those changes. I used to joke that I would stand between the door and the doctor so the doctor couldn't leave until all our questions had been answered. But then we'll make a note. And I know, like, these days the doctor will say, well, if you want the report, just look it up online. But I'm there writing it down, you know, so, you know, the client's weight, the client's blood pressure, you know, all of that information, because, you know, I might need to communicate that to the family immediately. Maybe the client hasn't set up their online portal to access all their medical records from that particular physician, because a lot of patients don't either have that capability, or they think if they don't look up that information, then it's not really out there.
Yeah.
So, you know, everything from making sure the client has their appropriate insurance cards, making sure that they have that list of medications, take those medications to the doctor, so we know what you know, medications they're on right now. And then I think one of the most important things is to communicate that to the other physicians, other doctors that are involved. So this might be a specialist, and, you know, in a perfect world, the specialist is going to communicate to the primary care physician, but it doesn't necessarily happen. And you know why? It's my responsibility. It is your responsibility. And when those people can't and need assistance, then we're here to help them. Because Absolutely. we can't just depend on the system working. You know, it's in a perfect world, it would, and everybody communicates effectively. But if everybody communicated effectively and everybody did what they were supposed to do, we wouldn't have care managers. I wouldn't have a job. So unfortunately, or fortunately, you know, I'm able to help those that do need that help with communicating and making sure, okay, this is what the specialist said, and this is what the primary care physician is saying. So, you know, and if they need to talk, I will try to set up that conversation between the two. But again, you know, then the most important thing, I think, is making sure that the client understands. I can understand what's going on. You can understand, you know, but making sure the client understands why it is that they need to start this medication, stop this medication, and then help them work through, is this a new diagnosis? What other information? Because the doctor is going to prescribe the medication. He's not going to verify, he or she, not going to verify if the client has the capabilities to set up a medication management system at home to make sure she gets that medication. Mm-hmm. That's what a care manager can help the family do, or help the responsible party do. That follow through, because our goal is to keep that person at home, be it is their home or an assisted living community, and prevent them from going into the hospital. And I know we're very excited because some of the things that we're putting into place right now, Ryan, we're going to be able to capture those outcomes and measure that data and show people, okay, look, when you have a care manager, when you have a care partner in the home, you're not going to be going to the hospital as frequently as your next door neighbor.
Yep, and it's solidifying our proactive, not reactive mentality.
Exactly.
and theme that we've always, tried to communicate through these videos about, being proactive about care and not reactive once a crisis hits.
Exactly. Well said.
Awesome. Well, thanks, Teresa. I appreciate it. Like I said, sometimes you don't realize how complicated these doctor's appointments get, especially when these specialists are involved. And it's good to have, these patients and someone in their corner that can really help make sure that everything is being done correctly and managed correctly and communicated correctly. I think we see that too much, that the lack of communication, I think sometimes between the different doctors and specialists and even the hospitals and doctors, is where we find a lot of our issues come in, especially with those medications, which is one of the leading causes of why people end up back in the hospital.
So what I'll challenge our viewers to is, the next time you call your mom or dad and you say, well, how'd the doctor's appointment go? Oh, it was fine. Think about, I wonder if we had a care manager there with a mom or dad, if I would be getting a little bit more information.
Besides
you most likely would, because that's a very typical, how's everything? Oh, it's fine. Doctor, everything's fine.
Absolutely. Well, thanks, Teresa. Again, I appreciate the insight and information there. And if anyone out there has any questions or concerns, feel free to leave a comment in the comment section below. There you can send us a direct message on Facebook, or you can always visit our website and visit our Contact Us form. Fill that form out, it comes directly to us, and we'll be happy to reach out to you and try to answer any questions or concerns that you have. So we hope to see everyone next time. Teresa, again, thank you so much, and we'll see everyone next week. Thank you so much.